Okay, we're connecting. 5, 4, 3.
Good morning, good afternoon, good evening. My name is Makiko Yashiro, and I'm with the UN Environment Program's Regional Office for Asia and the Pacific. And on behalf of the quadripartite partners, including the Food and Agriculture Organization of the United Nations, the World Health Organization, the World Organization for Animal Health, and UNEP, it is my pleasure to welcome you all to this Asia-Pacific Quadripartite webinar on Nagoya Protocol from One Health Perspectives. And just to give some background, the Nagoya Protocol on access to genetic resources and the fair and equitable sharing of benefits arising from their utilization under the Convention on Biological Diversity, which is also known as the Nagoya Protocol on Access and Benefit Sharing, is an international agreement adopted in Nagoya, Japan in 2010. And it provides a legal framework for the implementation of one of the three objectives of the CBD, namely the fair and equitable sharing of benefits arising out of the utilization of genetic resources, while also ensuring that it contributes to the conservation and sustainable use of biodiversity. And the parties have been implementing the Nagoya Protocol by taking measures such as establishing new or amending existing ABS legislative, administrative, and policy measures. And while these efforts are mostly led by the environment-related agencies and stakeholders, for the successful implementation of the Nagoya Protocol, there is strong need to ensure that the efforts are made through a cross-sectoral approach. And taking a holistic approach by reflecting perspectives, needs, and priorities of multiple sectors is essential for the successful implementation of the Nagoya Protocol. And this is where the One Health approach has an important role to play, and the reason why we are organizing today's webinar. The Nagoya Protocol is strongly relevant from the One Health perspectives, as it relates to the sharing of genetic material with relevance to public health and animal health, including epidemic and pandemic diseases and animal diseases. Objective slide, please. So with this background in mind, today's webinar will focus on providing an overview of the Nagoya Protocol, including its interrelationships with other global instruments, the status of its implementation at the national level, sectoral perspectives and experiences, including the environment, public health, animal health, and plant health sectors. And in addition to the perspectives and experience of the environment sector in leading the implementation of the Nagoya Protocol, sectoral perspectives and experiences from human, animal, and plant health sectors on pathogen access and benefit sharing in their respective areas will also be highlighted in this webinar. And we will also discuss opportunities to leverage on the One Health approach to help ensure that the Nagoya Protocol is implemented effectively by addressing the needs and priorities of multiple sectors and stakeholders. Could you kindly share the slide on the program, outline of the program? And we are showing the overall structure for today's webinar. We will first have keynote presentations, which will provide an overview of One Health as well as the Nagoya Protocol. And we are also very pleased to welcome Mr. Tokonjo Shikongo, who leads the work of the CBD Secretariat on ABS, to deliver a keynote presentation on the Nagoya Protocol. The second part of the webinar will then focus on various sectoral perspectives and experiences. And the third part of the webinar will be a panel discussion where we will hear various case studies from selected countries and the sub-region, highlighting experiences in ABS. And our sincere appreciation to the speakers who have joined us today to share their valuable perspectives and experiences from multiple sectors in relation to the Nagoya Protocol. So before we proceed, I'd like to make just a few housekeeping announcements. And as indicated earlier, this webinar is live streamed on YouTube. So unfortunately, we will not have an option for live questions and answer sessions for the general audience, but there will be a Q&A and interactive discussions between moderators and speakers. And after the webinar, we will be making the recording of the presentations available online. So with this introduction, I'd like to proceed with the first session focused on keynote presentations. And first, it is my pleasure to introduce Dr. Gyanendra Gongo, Senior Public Health Officer of the WHO Southeast Asia Regional Office, to deliver a presentation on One Health and Asia Pacific Regional Quadripartite initiatives. And Dr. Gongo has provided a recorded presentation, so I'd like to request our technical team to play his presentation now.
Good morning. It is my great pleasure to present One Health and Quadripartite initiatives and actions in the Asia Pacific region on the behalf of Asia Pacific Quadripartite One Health Secretariat. In my short presentation, I will try to introduce the One Health and what are the international initiatives, how Quadripartite is working for One Health and One Health Joint Plan of Action and its implementation, and Asia Pacific Quadripartite One Health Coordination Mechanism and initiatives, as well as take-home message. So One Health is an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. It recognizes the health of humans, domestic and wild animals, plants, and wider environment, including ecosystems that are closely linked and interdependent, and they are also interactive. It's based on One Health high-level expert panel definition. And when we talk about One Health, we have to understand that we should try to understand the communication, coordination, collaboration, and capacity building in order to operationalize One Health. Why One Health is important? Because we have intensification of agriculture as well as animal production to solve food security problem, and also we try to use chemical fertilizer, pesticide, fungicide, and veterinary drugs and antimicrobial substances to boost production, and through food chain it comes to our body. And deforestation, mining, and road construction as well as development activities, we are damaging our ecosystem environment, and that result in flash flooding as well as landslide and many natural disaster. And now climate change is real and it has impact on every sphere of our life. So the frequency of extreme weather condition is increasing year by year. So that is a real challenge, and that's why we need a holistic multidisciplinary approach. In addition to that, there are migration of people, internally displaced people because of war and natural disaster and economic conditions, and that also lead to many problems, humanitarian as well as environmental problems. And urbanization and globalization, these are also another important aspect which is accelerating transmission of disease as well as pest and all those things. Last but not least, pollution is a emerging problem like plastic pollution. It has impact not only in environment but also marine life as well as human health, as we saw various report on human health. And this interactive process interaction lead to emergence and re-emergence are emerging infectious diseases. 75% of them are of animal origin. There is investment case for One Health approach, and One Health is a systemic and inclusive approach that can tackle multiple crises such as climate change, zoonotic diseases, food safety and security, environmental pollution, and we should understand that 4.3 billion of ancillary benefit from reducing deforestation that will reduce the spillover risk as well as reduce the infectious disease pathway, and it also lead to lower carbon emission. And according to World Bank in 2022, 37 billion it is expected benefit of One Health to global community per year. And if we invest in One Health less than 10% of this amount, it will lead to 90% return on investment of a One Health approach. One Health is subject discussed in global political arena as well as technical meetings. So there is intergovernmental negotiating body and pandemic agreement, the discussion about prevention and One Health integration, and we have One Health group of friends, and we have UN General Assembly. There are high-level meetings on pandemic prevention, preparedness and response, and on AMR there are political declaration. There are meetings of G7 and G20. They are also discussing One Health issue, leaders and ministers declaration, policy brief, and in Rio in October there was high-level meeting on One Health, and they came up with declaration. There are also UN conferences as parties. So UN Biodiversity Conference, COP16, was held in Cali, Colombia in October, and we had UN Climate Change Conference, COP29, in Baku, Azerbaijan. All these platforms ask to have One Health approach. Quadripartite came up with One Health Joint Plan of Action. This is an option to establish a common strategy on One Health. It has 6 action tracks. Action track 1, that is enhancing One Health capacities to strengthen One Health health system, that is One Health governance. Action track 2, epidemic pandemic prone zoonosis, and action track 3, not all are epidemic pandemic prone. There are endemic zoonotic diseases, neglected tropical and vector-borne diseases. Elimination and controlling those diseases are very important, particularly low and middle income countries. Action track 4, dealing with food safety. Action track 5, antimicrobial resistance. Action track 6, integrating the environment into One Health. There are strategic direction of the Quadripartite. In Nairobi, at the sideline of UN Environmental Assembly, 4 organizations, they endorsed in principle the document Investing in One Health, the Quadripartite's offer for delivering on the One Health Joint Plan of Actions, which captures the 4 strategic priorities of the Quadripartite. So promote and support implementation of One Health Joint Plan of Action at country level, generate and share science and evidence for the implementation of One Health approach, maintain the political engagement and advocacy, strengthen core support to the Secretariat, including through sustainable funding, sustainable as predictable funding, and One Health Joint Plan of Action implementation guide. We have that guide provides countries with guidance to adapt and adopt the WOAH practical advice to national context according to its 3 pathway of theory of change, and it is inclusive and that allow each country to use it regardless of its status on One Health development and implementation. And definitely it is not only limited to human, animal, plant and environment sector, but also other government and non-government and even private sectors. So we all have to collaborate, coordinate with different sectors, at different level, not only regional, sub-regional, but also national and sub-national level. The basis of guide is three pathway of the theory of change. There are three pathway: governance, policy and legislation, financing, advocacy. Pathway 2, organizational development, implementation and sectoral integration. Pathway 3, data and evidence generation and knowledge exchange. At the regional level, we have regional quadripartite coordination mechanism for One Health in Asia and the Pacific. So we have four organizations: FAO, WOAH, WHO, and UNEP, and we created coordination mechanism like one quadripartite management group, quadripartite coordination group, as well as technical working groups, according to 6 action track plus 1, that is cross-cutting, advocacy, risk communication, and community engagement. And we are working with regional specialized organizations like ASEAN and also donor and partners. So we have created this Asia Pacific platform. So we organized this workshop in September 2023 in Bangkok. They came up with a recommendation to member states, quadripartite partner, as well as international partners. And that's why we are trying to focus on implementation of those recommendations. So in 2025, we'll report back in another quadripartite workshop. So we have done national OSJP workshop in Bangladesh in February and national OSJP workshop in Mongolia. And similarly, Pacific Island countries, they have specific needs and consideration. So we organize Pacific One Health meeting in August 2024. What are the take-home messages? One Health is not a new concept, but holistic approach to address issues and challenges emerging at the human-animal ecosystem interface. There is a growing recognition of One Health. However, it has to be translated from concept into action through country-level activities. Ownership, leadership, and partnership are essential for One Health collaboration. One size does not fit for all. Each country, they have to consider country context, needs, and priorities for One Health, think globally, and act locally. There are popular thoughts on One Health. If you want to go fast, go alone. If you want to go far, go together. It is African proverb. And as Henry Ford has mentioned, coming together is the beginning, staying together is progress, and working together is a success. Thank you very much for your attention.
Thank you very much, Dr. Gongo, for your comprehensive presentation and providing an overview of One Health approach and quadripartite initiatives. And what you mentioned about now is the time to really translate the concept of One Health into concrete action. I think Nagoya Protocol implementation provides a perfect opportunity for this concrete action on the ground. So thank you very much. So now we will quickly move to the next keynote presentation, and it is my pleasure to invite Mr. Tokonjo Shikongo, head of the ABS unit of the CBD Secretariat, to present an overview of Nagoya Protocol. And Mr. Shikongo has kindly joined us live from Montreal, Canada, where I understand it is right now almost midnight. So thank you very much, Mr. Shikongo, for joining us live today, despite this inconvenient timing. So Mr. Shikongo, the floor is yours.
Are my slides there? Well, while they're coming up, I'll just proceed. Well, as was said, I'm Sam Nagoya Shikongo, and the first slide I had there was showing an ABS timeline, just showing when it started. And in that presentation that you cannot see now, there is the timeline that shows that the search for information on interesting biomolecules has been with humanity for a very long time. And towards the end of that slide, it shows that DSI emerged as an issue around 2018. So at first, people looked for the tangible genetic resources, and now it's simply the digital sequence information of those tangible resources. And we see that in 2008, we've got the bond guidelines on ABS. Can you go back one slide? Can you go back one slide? Yeah, okay, next slide. Next slide. Yes, that one. So you'll see that in 2008, you've got the bond guidelines, which was a response by CBD parties to try and give effect to Article 15 on ABS, but that the bond guidelines were voluntary. Then we see Nagoya Protocol coming in 2010, and then we see in 2022 the digital sequence information decision to share benefits. So today, the Secretariat is the lead agency and world reference for facilitating policymaking on both ABS and DSI. The CBD processes and principles are being followed and adopted by other international instruments and presents enormous potential for mobilizing new resources for biodiversity, as well as fostering the fair and equitable sharing of benefits that arise from the utilization of genetic resources. Can I move to the next slide? Now, the convention has 3 objectives, as you can see there. And the convention arises out of the Brundtland report that simply stated about our common future. And together with the CBD was also the UNFCCC, climate change. And important one that we don't always now talk about is also the UNCCD desertification and land degradation, because all of these actually happens on the land as the platform. Whatever happens to the land will happen to the rest. And so these 3 together are the so-called Rio Conventions that came out of Rio in 1992 during the Earth Summit. Now, the Nagoya Protocol, the Convention on Biological Diversity, has 2 protocols. We've got the Regional Protocol on Biosafety, and then also the Nagoya Protocol on Access and Benefit Sharing. Next slide. So we zoom into Article 15 that established the principles of ABS. And this article provides for an equity dimension in that access to genetic resources is granted in exchange for the sharing of benefits derived from their use of those genetic resources. By enabling countries to control access to their genetic resources through negotiating benefit sharing terms on mutually agreed terms, as well as prior informed consent, through that you can then grant access. And the intention was to create incentives to conserve biodiversity and to use it sustainably. It also, of course, brings in Article 8J on traditional knowledge, innovations, and practices that are associated with those genetic resources, because that many times is sort of the pointing finger to the resource in terms of its utility. And next slide. So now, when we look at can I have the next slide, please? When we look at the benefits that arises from the use of genetic resources, there are of 2 kinds. There is the monetary, when research and development will lead to a commercial product, and there are the non-monetary benefits, and in that case, technology transfer, capacity building and development, enhancement of research skills have come out as important ones. And through all of these, we see that ABS has become a vehicle to achieve the Sustainable Development Goals, social justice, equity, and fairness, and these impact on livelihoods of the custodians of biodiversity through achieving those SDGs. Next slide. Now, all of that led to the Nagoya Protocol on ABS, which gives effect to Article 15 of the convention. The Nagoya Protocol helps to create an environment that promotes mutual trust for the benefits of all. For the users of genetic resources, it provides new business opportunities and advancement of scientific research and innovation. For the providers of those resources, it provides an opportunity for sustainable development through sharing of benefits, as I said before, that can be monetary and non-monetary. For indigenous people and local communities, it gives them the incentive for promotion and protection of their traditional knowledge, innovations, and practices through the benefits that they receive fairly and equitably. And all in all, achieving the objective of this protocol contributes to the conservation and sustainable use of biodiversity, and through that, human well-being and that of the planet. So users and providers are thus encouraged to direct the benefits towards the conservation and sustainable use of biodiversity and its various components, noting that biodiversity is defined as the entire varying, fascinating variety of life that we see on Earth. And also we look at it from the ecosystem level, species level, and genetic level. Now, the next slide. The question comes to the fore as to why then the Nagoya Protocol on access and benefit sharing if the convention itself had Article 15. We saw that through the implementation of the convention, the CBD provisions were not fully implemented. There was lack of clarity on how prior informed consent was to be obtained, as well as how mutually agreed terms were to be established between the provider and the user. And the bond guidelines, as I've said, were voluntary. And although they did advance some aspects of implementation, their voluntary nature hampered their implementation. And we also saw that many countries adopted their laws, but these laws were considered to be an impediment to research as they became quite restrictive in terms of granting access to genetic resources. And so developing countries as providers of genetic resources were concerned about the misappropriation of their genetic resources and associated decay, the traditional knowledge. So there was a need for greater legal certainty and transparency. And that meant then for the provider, it is to ensure that benefits are shared by users once the genetic resource leaves the provider countries. And it meant for users, they simply wanted to have very clear procedures for access to genetic resources, noting that if there is no access granted, there can be no benefits generated. Next slide. Next slide. May I have the next slide, please? So if we look at we call it the ABC of ABS, we need to know that under the convention, ABS can be multilateral between one party and or many parties, whereas under Nagoya, the way it has been designed, it is a bilateral instrument where there is a provider giving access to a user. Now, the protocol provides flexibility in how its provisions are implemented. In terms of the access provisions of the protocol, it addresses the concerns of users of genetic resources, and it establishes obligations to grant a permit, providing evidence that prior informed consent was granted and that mutually agreed terms was established. In terms of benefit sharing, the protocol builds on the CBD provisions and include a list of monetary and non-monetary benefits that can be selected from in this transaction. And the provisions on compliance address the concerns of providers of genetic resources. This was the key innovation of the protocol, this compliance mechanism. And so we see that parties are to take measures so that users under their jurisdiction respect the ABS requirements of provider countries. And it's important to point out that users is not simply a user from another country going to one country and using the genetic resources, but also your own national users are obliged to follow the provisions of the protocol. So they have to comply with ABS legislation, and they have to comply with the mutually agreed terms, and also with respect to monitoring the use of genetic resources once they have left the provider countries. And for that, there are checkpoints and an internationally recognized certificate of compliance that accompanies the resources as they go along the value chain. Now, the next slide is showing the distribution of parties to the Nagoya Protocol that have ratified or acceded to it. Currently, we've got 141 parties, and soon this month we will have the 142nd party, which will be Costa Rica, once 90 days have passed. They have already tabled their instrument of ratification. From that map, the dark green are the Nagoya Protocol parties. The yellow, which we cannot really see, that's Ireland that have ratified but not yet a party. And the gray areas are those countries that are not yet party to the protocol. Next slide. Now, in terms of national implementation, the parties have to implement the provisions of the Nagoya Protocol at the national level. And for these, the ABS Clearinghouse is a key provision because it contains a wealth of information, as parties have to publish their ABS measures and provide information on national focal points, etc., on the clearinghouse. It was launched in 2014, and the other information that we have on that clearinghouse is that it has a virtual library of ABS-related publications, as well as information on capacity building initiatives and community protocols of indigenous peoples and local communities. So if we move to the next slide. And here I'm starting now to move into the provisions that are related to the One Health approach. We see that the Nagoya Protocol has got Article 8B, and parties recognize that further work may be needed as a priority to develop access and benefit sharing legislation and regulatory requirements which provide for legal certainty, clarity, and transparency, especially taking into account special considerations on in accordance with this Article 8 of the protocol and the need to ensure that the Nagoya Protocol and other relevant international instruments are implemented in a mutually supportive manner. And therefore they have to pay due regard to cases of present or imminent emergencies that threaten or damage human, animal, or plant health as determined nationally or internationally. The last assessment and review showed that we've got around 56 of the parties to Nagoya that have paid due regard to such cases, and whereas 41% of the parties have taken into consideration the need for expeditious access to genetic resources in cases of emergencies that are concerning public health. Then we've got the Article 4, especially Article 4.4, that the protocol is the instrument for the implementation of ABS provisions of the convention. And this Article 4.4 leaves space for other international instruments to articulate a health-specific version of ABS provisions, and it exempts Nagoya parties from the provisions of the protocol with respect to specific genetic resources, which may be covered by a specialized international instrument, provided, though, that such an instrument is consistent with and does not run counter to the objectives of conservation, sustainable use of biodiversity, and fair and equitable benefit sharing. It should be noted again that while the approach of Nagoya Protocol is bilateral, there may be other instruments that are not like that. And this issue raises concern among some parties, especially in the case of public health emergencies, despite the provisions of this Article 8B that I just read out before. And another key concern is whether it is the Nagoya Protocol Conference of Parties that has the, or meeting of the parties that has the authority to decide on whether an instrument is a specialized international ABS instrument or not. And this issue was being considered now at COP5, and further work has been outlined for it. And I'm now moving to the next slide and putting all of this within the context of the Kunming-Montreal Borders Framework, which is now providing the strategic framework within which the CBD is operating towards the vision of 2050, a world of living in harmony with nature, where we hope that biodiversity will be valued, conserved, restored, and wisely used, whilst we maintain the integrity of ecosystems. Now, COP15 was a milestone setting global conference for the environment. And within that, we see that ABS is central, or has been made central, to the Kunming-Montreal Global Framework, and its importance was evidenced by the inclusion of Goal C and Target 13. If we can move to the next slide. So the GBF has got 4 goals and 23 targets. Now, if you look at Goal C, we see that it includes both ABS under the Nagoya Protocol, and it also takes it further that it also brings in the benefits from digital sequence information. Now, Goal C simply asks that monetary and non-monetary benefits from the use of genetic resources and digital sequence information and of traditional knowledge that are associated with genetic resources should be shared fairly and equitably. And we also see that it has introduced the requirement that we have to monitor and report whether benefits have been generated, both monetary and non-monetary, and we have to demonstrate an increase in those benefits. So we are now busy developing the methodology for monitoring and reporting on the global benefits. Moving on to the next slide. Now, within the Kunming-Montreal Borders Framework, there are requirements towards its implementation, and one of the key instruments there is the development or update, revision, and alignment of the National Biodiversity Strategy and Action Plans and the associated National Biodiversity Finance Plans. And within, as we are asking parties that as they revise and update and align, that they ensure that ABS is centrally covered within those NBSUBs. And this then must be done following the whole of government, whole society approach. And doing so will contribute to synergies at national level, also at the international level with other biodiversity-related conventions. Doing so will help us to synergize in terms of the use of human, technical, financial, and technical resources, but also to assure that there is policy and regulatory coherence at national level, but also at the international level, and foster integration and mainstreaming of ABS across all development sectors. And that will be useful also for scientific and technical collaboration and establishing collaborative frameworks, as was said by the first speaker before me. Realizing these synergies requires overcoming challenges that are related to policy integration, resource allocation, and scientific collaboration, but only, as was said, together. If we can work together, we can achieve that. Now, the next slide looks at linking can we move to the next slide? So how do we provide this linkage of ABS or Nagoya Protocol to the One Health approach? Of course, under the ABS, we're looking for fair and equitable sharing of benefits arising from the use of genetic resources, Whereas here with One Health, there is also the issue of pathogen sharing and assuring that there is also fair access to vaccines and products. So that equity and fairness comes into being. And then there is that mainstreaming and multi-sectoral collaboration, which then is good for international collaboration, but also multilateral engagement at the international level. And all of these can then enhance the global response to health threats or even public health emergencies. Now, as was said by the previous speaker, we just concluded the UN Paris Conference in Cali, and it had 3 concurrent meetings. We had the COP16 for CBD, COP 11, Cartagena Protocol, and COP 5, Nagoya Protocol. And the outcomes there was of note is that we have established the Cali Fund for digital sequence information in decision 16/2. That's a milestone, and that decision has quite a lot of innovative and ambitious objectives. Then the COP also strengthened the role of IPLCs in decision 16/4 and 16/5 in establishing a new program of work on Article AJ and the establishment of a new permanent subsidiary body on Article AJ. And if we take this into cognizance that the IPBES report said areas under management of IPLCs are doing fairly well, then this is truly a good achievement. In relation to Nagoya Protocol COP 5, the outcomes for us there was the compliance and evaluation of Nagoya Protocol decision, and there they have adopted the methodology for the second assessment and review of the protocol, which will start by soon. It has to be done by 2026. And then we've got the implementation of the Nagoya Protocol, the related decisions, and there we have adopted the capacity building and development action plan for the Nagoya Protocol in this Nagoya Protocol 5/3. And this we're giving to parties saying, well, if you use that, you can hopefully then implement the Nagoya Protocol. Here, I'm providing you simply a list of useful resources on ABS. It's the ABS Clearinghouse Mechanism, our website there, and the Conventional Global Biodiversity Framework. We've got a site there where we give more information about Target 13 and Goal C. We've also got e-learning courses for ABS Nagoya Protocol and how to go about with that, as well as capacity building, education, public awareness toolkit that include considerations on ABS, as well as awareness raising materials that are on the CBD webpage. Let me stop there.
Thank you very much, Mr. Shikongo, for your very comprehensive presentation, providing an overview of the Nagoya Protocol. And certainly it provides a very useful background information for discussions today. We would have liked to ask some follow-up questions to you, but due to limited time, we'll skip the Q&A session, but hope we will have a future opportunity to have more interactive discussions and maybe potentially in the future follow-up webinar on this topic. So thank you very much for sharing your valuable insights today, and please stay warm in snowy Montreal.
Thank you very much, and we are grateful that you have given us this opportunity to present Nagoya Protocol, and we hope that this creates more awareness and implementation of the protocol. Thank you so much to all of you.
Thank you very much. And according to the agenda, we are supposed to play a short introductory video on ABS, but due to time constraints, we'll skip it. But if you're interested, please check this video available online. The title is ABS Simply Explained. So now we would like to quickly move to the next session. The session 2, which is focused on sectoral perspectives on Nagoya Protocol and its implementation. And we have the speakers representing environment, plant health, public health, and animal health sectors. And the speakers will be sharing with us their perspectives in terms of the relevance of the Nagoya Protocol for each sector, including their priorities, experiences, and some challenges faced in implementing the Nagoya Protocol. So first, it is my pleasure to introduce Dr. Balakrishna Pisupati, the head of UNEP India office, to share perspectives of the environment sector. And Dr. Pisupati has provided a recorded presentation, so I'd like to request our team to play his presentation now.
Good morning, good afternoon, good evening, colleagues, from wherever you are joining this very interesting and important webinar on looking at the aspects of access to genetic resources and benefit sharing in the context of One Health. I'm grateful for the invitation. As you can see, my name is Balakrishna Pisupati. I work at the UN Environment Program. And what I'm going to be doing in the next few minutes is to give you a little bit of a context within which we are discussing access and benefit sharing in 2024. And as you can see from the title, the issue of access and benefit sharing, even during the negotiations of the convention itself and the Nairobi Final Act, and as and when the text for the convention, Article 15, was being negotiated and put in place, the fundamental principle on which access and benefit sharing discussions were held was to look at balancing the rights of providers and users. So that is, to an extent, the fundamental principle based on which we all started looking at the issue of access and benefit sharing. And if we are going to be looking at the evolution of the discussions on access and benefit sharing in the context of Nagoya Protocol, the principles of equity and fairness are universally accepted. There is no one who denies the fact that when somebody benefits from using a resource, the provider of the resource should be compensated, should be provided with some benefit of such profit that is being made by the user. So even though in principle this particular issue has been agreed, it took several years, more than a decade and a half, to operationalize the entire principles of fairness and equity in the context of access to resources and sharing the benefits when the resources were commercially exploited and used. But the challenge has always been in the operationalization of this entire thing. And what the Nagoya Protocol provides us is a framework within which a lot of these things are happening. Having been associated with the discussions on access and benefit sharing almost since 1994, when I first organized a regional consultation for Asia, when I was working at IUCN at that time, the fundamental question I asked to myself is that why is this entire issue of access and benefit sharing so complicated and complex? And that actually also has a resonance in the way some of the things are being discussed in the context of One Health approaches today. Because fundamentally, when you're talking of One Health, we are looking at the issue of access to resources for human health, access to resources for animal health, access to resources for environmental health, and all of them related. But in the context of the Convention on Biological Diversity, a number of these issues are discussed fairly, to an extent, independent, because other processes started emerging much later than the discussions under the Convention on Biological Diversity had started. So the access and benefit sharing issues, if one is going to be looking at it on where the complexities lies, the complexities lies at 4 levels. 1, at the level of ABS issues for providers of genetic resource. 2 is ABS issues for the users of genetic resource. And 3, ABS issues for policymakers and ABS issues for implementers. And what I'm going to do is to very quickly take you to 4 cartoons. I just want to make it a little easy and simple for us to understand where the challenges or where the issues for all these 4 groups of stakeholders have been in the context of access and benefit sharing. If you look at the cartoon there or the picture there, that actually to an extent explains the challenges the access and benefit sharing issues are faced by the providers. as you can see from that cartoon, this person is trying to look at the end of the roll of tape. Of course, he knows that the tape is too big, it's quite voluminous, you can use it for too long, but where to start? Where do we start the discussions in terms of providing access, and what kind of benefits should the providers be asking for has always been an issue of challenge. And to a large extent, even though countries have progressed in the issue of access and benefit sharing, if there is one question where we still have not found correct and clear answers, is that are we looking at benefits? Are we looking at the resources that are being accessed and the benefit sharing associated with it, including on traditional knowledge? Are we adequately addressing the issue of value of these resources? To an extent, unless the values are very clear, the discussions on benefits are going to be unclear to the extent that we can imagine. The second issue, or the second group of people who really sometimes get caught up or get caught with these discussions, not necessarily being very clear of where they started and where they're going to end up, will be the users. So that's where the perspective for ABS, or the access and benefit sharing for users, is something like what you see on the cartoon, where this lady is saying that he's not walking backwards, but you've got the leash on the wrong end. So certainly for a lot of users, this is exactly the kind of situation they find themselves in, with lack of clarity on what needs to be done, where they have to start, and which direction they should be moving. In spite of countries having the ABS frameworks, still there are actually lack of clarity and gaps in the way users are able to understand and then put their act together in terms of responding to the access and benefit sharing provisions. A key element of it is this very fundamental principle of access and benefit sharing discussions, because remember, access and benefit sharing has to be negotiated. It has to be negotiated between the provider and the user. But to an extent, many states actually still have not clearly understood the negotiation element of access and benefit sharing. We have this interesting group of stakeholders, policymakers, who discuss and develop the frameworks on access and benefit sharing. And as you can see from that slide, it is like a maze where we still have challenges in terms of policymakers on where to start and where to end, which direction they should go, which turn they should take, so that they can enter the maze of policymaking related to access and benefit sharing. But they come out successfully with having a framework that actually captures the elements of fairness and equity and benefit sharing. And the last set of stakeholders are those who are the implementers, because not necessarily the policymakers are the implementers. Implementers are the local governments, implementers are the providers, implementers are the users, implementers are the research organizations. So certainly what you see on the screen, that particular card also captures to an extent where the implementers see for themselves, where this person is saying that according to these advanced formulas, we are way underpaid. So essentially, all of us know what the problems are, but we still are looking at complex algorithms and complex ways of understanding what these problems are. And that's where some of the challenges related to access and benefit sharing implementation comes to play at the national level. So today, if you are going to be looking at access and benefit sharing in 2024, those 5 are the key elements that are the questions that we need to be asking for ourselves. Is access and benefit sharing providing the benefits that it has intended to provide? Are these efforts to find synergies among different processes and institutions working? Today, I'm sure through this particular event, we are going to listen to a number of different presentations, including from the World Health Organization, where there is a discussion that is going on access and benefit sharing in the context of an international negotiation for developing a treaty on pandemic readiness. So definitely there are questions being asked on, are these approaches, are the principles under which access and benefit sharing is being discussed, whether it is in the Convention on Biological Diversity, whether it is in the International Treaty on Plant Genetic Resources, whether it is in the WHO parlance. And also remember, we do have a new treaty, the Biodiversity Beyond National Jurisdictions, that also discusses the issue of access and benefit sharing. So it is very important to understand on how these processes actually are talking to each other and where there are similarities and differences to deal with it. And the third question is to ask ourselves, in spite of the protocol that was adopted and had come into force and countries having national frameworks, on access and benefit sharing, is it very effectively being implemented? And one measure of effectiveness is the amount of resources, monetary or non-monetary benefits, that are flowing back to communities, that are flowing back to conservation efforts that we need to discuss. The fourth question is the link between access and benefit sharing and the issues of digital sequence information and benefit sharing. We are all aware of the outcomes, very good outcomes of the Cali COP16 meeting of the Convention on Biodiversity, but it is very important to reconcile the elements of the discussions on benefit sharing, the Cali Fund, the operationalization of the Cali Fund in the context of access and benefit sharing. And lastly and importantly, is the industry aware of their obligations? And I would say, having been working and been associated with a number of these discussions for many, many years, still the industry is unclear on their roles and responsibilities. The environmental perspective of access and benefit sharing in this context is to look at those four elements of it. The conservation and sustainable use perspective coming from the Convention on Biodiversity, the human health perspective coming from the World Health Organization, the plant health perspective coming from the International Plant Protection Convention, and lastly, importantly, the animal health perspective coming from FAO and its processes and activities. So under the One Health approaches, if one is going to be looking at where we start and where the discussions need to be pegged, those are the four elements that I will would like to share and end my presentation. One is ABS approaches deal with plant, animal, microbial, and digital resources, but each one of them they are unique, they are different, and they actually need a different form of discussion when it comes to benefit sharing. The current processes on access and benefit sharing and the discussions on digital sequence information to an extent need to be consolidated, and we need to find linkages. Past efforts to understand and integrate such approaches not necessarily have yielded at the best possible results. And lastly, national capacities and understanding is still limited on ABS issues related to One Health approaches. So what we require today is not to look at ABS in a very siloed approach, but look at ABS as an integrated option, as an integrated approach for looking at conservation, sustainable use, and fairness and equity in the context of raising financial resources, but also plowing it back for community development and sustainable development. Thank you very much for your interest, and thank you very much for your cooperation and for listening to the presentation. And apologies for not being able to be present at the webinar, joining live in person. Thank you very much. Bye.
Thank you very much, Dr. Pisupati, for his presentation. And I think his presentation really highlighted the need for us to look at ABS as an integrated approach instead of siloed approach, and taking into account multiple needs related to conservation, sustainable use, fairness and equity in terms of financial resources, benefits to communities, and so on and so forth, which are all important for environmental sector perspectives, but also other sectors' needs and perspectives. And also taking into consideration the various relevant international mechanisms and processes. So now we will quickly move to the next speaker from the plant health sector. And it is my pleasure to invite Ms. Sarah Brunel, head of the International Plant Protection Convention Implementation and Facilitation Unit of the FAO IPPC Secretariat, to talk about the Nagoya Protocol and its relevance to plant health. Thank you very much, Ms. Brunel, for joining us live today. Now you have the floor, and you have approximately 8 minutes. Thank you.
Wow, thank you. Thank you so much. It's really my great pleasure to be with you. I will be sharing my screen. So indeed, I'm representing the International Plant Protection Convention. And I will talk about plant health. Just to give a bit of background, pests represent a huge threat, and it's counted that 40% of all food crops are being affected by plant pests. Hence, the International Plant Protection Conventions is recognized by the World Trade Organization, along with WOAH and Codex Alimentarius, as a standard-setting organization for plant health and preventing these pests through standards and implementation. And the link with the Nagoya Protocol is that the IPPC is also part of the CBD liaison group for biodiversity-related conventions. The IPPC Secretariat works globally, collaborating with 10 regional plant protection organizations, among which APPC in Asia, as well as a lot of other organizations. And indeed, we already published some 46 international standards for phytosanitary measures, as well as guides and e-learning courses. So the IPPC exists since 1951. And that's the sole global international treaty to secure collaboration among nations in protecting global plant resources. So here we are with these plant resources. The IPPC has its own strategic framework embedded and compliant with the FAO strategic framework. And the objective is really to enhance global security, protect the environment, and facilitate safe trade. I will be touching on very concrete example of why plant health is essential to One Health and how that contributes to the Nagoya Protocol, considering that plants are the source of everything we eat, of the quality of the air we breathe, of our clothes. And I will give a few examples of cross-sectoral synergies. First of all, when we think of One Health collaborating with our colleagues in FAO, we think of emerging pest outbreak and alert response systems. So our goal is really to synchronize, to collaborate with our colleagues. So we identify pest risks, plant pest risks at the global level to set global alert and response mechanisms. We have exactly the same thematics, epidemiological issues with our animal health colleagues. So sharing information there for a better efficiency in setting criteria for those pests and in coordinating a response. And I'm glad to report that we were asked by our governing body, the Commission on Phytosanitary Measures, to take a global leading role in the coordination of activities related to a specific pest, which is very well known in Asia, Banana Fusarium tropical race 4. We concluded a lot of activities, publication of guides, various trainings on diagnostic, surveillance, and transferring knowledge from Central America to Africa for what concerns simulation exercise, which are a strong and important capacity development exercise. Capacity development is indeed crucial for countries to be autonomous, and that's something which was highly mentioned during the Committee on Agriculture, which concluded in October, which is a major governing body for FAO. And in that vein, we are developing an innovative digital campus, the IPPC Plant Health Campus, with learning passes. So all stakeholders, so national plant protection organization, but also universities, importers, exporters, could train themselves on the various plant health aspects. We have shared some examples on our website, and I invite you to read those spotlights on how various countries are using these, and I really encourage this to be taken in Asia as well. We have another flagship tool, which is a phytosanitary capacity evaluation, and that's one of the One Health tools mentioned by the OLEP One Health tools. It is equivalent of the WOAH PVS, and we're also collaborating very well as it is equivalent of the food safety assessment tool. So you see the three sisters have the three similar assessment tool for countries to identify what are their gaps and how they can further strengthen their systems. It's a very thorough and structured process in 3 steps: situation analysis, strategic planning, validation, with very concrete outputs. So the setting by consensus with all stakeholders at the national level of a national phytosanitary capacity development strategy as well, and it's possible through the support of our FAO colleagues in the legal unit to revise the phytosanitary legislation. We had resounding successes in Senegal. I invite you to read our case and how that allowed Senegal to mobilize almost 1 million with the Standard and Trade Development Facility. But closer to you, we also have successes in Cambodia and Sri Lanka, and how now Cambodia is also mobilizing 2 million to favor its exports. So very concrete outputs. You see we're implementing this tool across the world. That's only a snapshot of the latest PCEs. And we have over 30 years of data from all countries around the world. I also want to raise the case of electronic certification. So, each plant moving in trade need to have a certificate. It has always been in a paper format, but the plant health sector was very innovative and leading the way for digital transformation, having this ePhyto solution developed by the IPPC Secretariat for cheaper, safer, and faster trade. And we're partnering with the private sector, namely Global Alliance, to implement this in Africa in particular, which is, you see the map, the continent which needs most efforts in implementation. It's already a lot of ePhyto exchange across the world, 7 million. And I invite you to consult our website and read our success stories in Uganda, Korea, Argentina. Each one developed treasures of innovation to really make the best use of that very fundamental tool for ensuring a safe trade. And finally, a topic which is common to the 3 disciplines within One Health is the one of antimicrobial resistance. It was IMR week recently. We are doing our share into aggregating data on IMR because resistance to antibiotics and fungicides affect plant, human, and animal health under the One Health concepts, and we need to aggregate cross-sectoral data to be efficient. So that's why we're in the process of launching, in the framework of our observatory, a survey, and the results will be available in next year. We're going to have already a glimpse of these at our Commission on Phytosanitary Measures to be held in March next year. So that leads me to our conclusions to advocate for a better representation of plant health within One Health, as plants are really the root of all healths. We have as IPPC Secretariat, implemented the One Health as much as we can within FAO, and I'm very glad our colleagues from the FAO One Health unit is here, but we're also working with the decentralized office network as well as relevant partners. We are committed to be further involved in the quadripartite, and that was requested by the FAO Committee on Agriculture as well as the Council, so I'm very glad we're making links here today. We've also contributing to the One Health priority program areas within FAO. And just to continue this excellent initiative, we will be organizing a science session on One Health during our Commission on Phytosanitary Measures to be held from 17 to 21 March in HQ. So we will certainly build on what is being discussed here today to further advance at the global level the quadripartite interactions and the inclusion of plant health within One Health. That's it from my side. Thank you very much for your attention.
Thank you very much, Ms. Brunel, for your very comprehensive presentation and highlighting the perspectives from the plant health sector. And I think you really highlighted the fact that Nagoya Protocol is has this interface at the global level with the IPCC Secretariat. There is collaboration going on, but also you really highlighted a lot of initiatives and entry points in terms of the plant health and related initiatives and efforts in the context of One Health. So thank you so much for your valuable insights. So next, moving on, it is my pleasure to introduce Dr. Dan Hugen-Dobler, Technical Officer of WHO Headquarters, to talk about the Nagoya Protocol and its relevance to public health sector. And I understand that he provided the recorded presentation. So may I request our colleague to play the video? Thank you.
Good morning, good afternoon, and good evening, colleagues. Thank you to the Asia Pacific Quadripartite One Health Secretariat for the invitation to join you today. I'm really sorry that I couldn't be with you in real time. The reason for this is that this week member states are meeting in Geneva to negotiate a pandemic agreement, and I'll discuss this a little bit later. Unfortunately, these negotiations overlap with the webinar. I've left my contact details at the end of the slide deck, and I really hope that you won't hesitate to contact me with any questions that you might have at the email address that I provide at the end. So today I've been invited to share a few thoughts on the Nagoya Protocol and public health. The Nagoya Protocol and access and benefit sharing more broadly touches on many aspects of public health. However, today I'll focus on the largest and I think the most relevant aspect, which is pathogen sharing. And I'll cover three areas in particular. First is why sharing pathogens and the benefits that arise from the use of pathogens is so important to public health. Second is a brief overview of how pathogens are shared in practice. And then third, just a brief discussion of multilateral approaches that can provide innovative ways to ensure a rapid and timely access to pathogens. And then on the flip side, the fair and equitable sharing of benefits. So let me start by briefly discussing why sharing pathogens and the benefits that arise from their use is so important to public health. And that sharing creates many benefits. So rapid, timely, and comprehensive sharing of pathogens is really essential to developing vaccines, such as seasonal and pandemic influenza vaccines, and diagnostics like the COVID-19 tests I know that many of you are very familiar with from the pandemic. And this sort of sharing also allows global surveillance of potentially dangerous pathogens, early warning of potential outbreaks, and risk assessments. And these are just some general examples, but there are many other benefits and far too many for me to list here in detail. But then equally as important as the rapid, timely, and comprehensive sharing of pathogens is the fair and equitable sharing of the benefits that arise from their use. So for example, vaccines, diagnostics, and therapeutics should be shared equitably with everyone who needs them. And all countries should benefit from information, alerts, and risk assessments derived from the pathogen sharing. As the recent COVID-19 pandemic reminded us, no one is safe until everyone is safe. I won't discuss this slide in detail. It's just to summarize some of the work that WHO has done on the intersection between the Nagoya Protocol and public health. As you can see, there's been quite a bit, and we continue to work closely with the CBD Secretariat and other relevant UN agencies on this important topic. So while it's a bit beyond the scope of this presentation, I just wanted to briefly mention that the most common form of pathogen sharing now is the sharing of digital sequence information, or DSI, from pathogens. And increasingly, DSI can substitute for the physical sample for a wide range of uses, although access to the physical samples remains important. So I'm not discussing it today because the discussion on DSI has taken place largely outside of the Nagoya Protocol context, including the recent decision at the CBD COP that operationalizes a multilateral benefit sharing mechanism for DSI. That was in Cali, Colombia, just last month. However, pathogen DSI is critically important for public health, and it's likely to become more so as the technology advances. So then turning back to physical pathogen sharing, these materials are shared in two main ways. The first is through ad hoc or bilateral arrangements. And these transfers are typically subject to prior informed consent or PIC, and mutually agreed terms or MAT. And that's in accordance with the Nagoya Protocol and of course the relevant domestic measures implementing the Nagoya Protocol or other access and benefit sharing measures at the national or subnational levels. And then the second way in which many pathogens are shared is through the coordinated networks. And these are things like the Global Influenza Surveillance and Response System, GISRIS. And these networks are often composed of government or other research labs that share viruses in accordance with some terms of reference. Transfers within these networks, of course, they have to comply with the provisions of the Nagoya Protocol and domestic regulations and other measures. But in some cases, pre-agreed standard material transfer agreements can facilitate compliance with the Nagoya Protocol. And this is the case with the sharing of influenza viruses with human pandemic potential within the GISRIS, the Global Influenza Surveillance and Response System, just as one example. So now that we've looked at the importance of pathogen sharing and how it is done in practice, I wanted to briefly return to the heart of this webinar, which is the intersection between the Nagoya Protocol and pathogen sharing. And the most important point I want to make here is that the Nagoya Protocol leaves a great deal of discretion to parties on how they want to implement the agreement. That means that the impact that Nagoya has on public health depends a lot on how countries choose to implement it. And to repeat an earlier point, public health really depends on ensuring that pathogens can be shared rapidly and comprehensively, and that benefits are shared fairly and equitably according to public health need. The Nagoya Protocol and the text provides all the tools that are needed for countries to promote public health in this way. And I just wanted to that end to briefly mention two provisions of the Nagoya Protocol that are particularly relevant to public health, I think. The first is Article 8b, and that calls on parties to pay due regard to cases of present or imminent emergencies that threaten or damage human, animal, or plant health as determined nationally or internationally. And it mentions in particular considering the need for expeditious access and benefit sharing, as well as access to affordable treatments. And then another especially relevant article is Article 4.4, which states that where a specialized international access and benefit sharing instrument applies that is consistent with and does not run counter to the objectives of the convention, the CBD, and this protocol, the Nagoya Protocol does not apply to materials within the scope of the specialized agreement. And there are ongoing discussions within the meeting of the parties to the Nagoya Protocol and the interpretation of this article, but it does provide some important clarity on multilateral instruments, which is the topic of the next slide. So this is the last topic I'll discuss in this very brief presentation, which are multilateral approaches to access and benefit sharing for pathogens. And I think these approaches can really help to provide some legal certainty to providers and users of pathogens. They can help to speed up sharing, and they can facilitate the generation and sharing of benefits. The one example that's in place in WHO at the moment is the Pandemic Influenza Preparedness, or PIP framework. It covers influenza viruses with human pandemic potential. The Global Influenza Surveillance and Response System, GISRIS, which I mentioned before, is a global network of laboratories that forms the backbone of the PIP framework through which the viruses are shared. The PIP framework then has two benefit sharing mechanisms. The first is the partnership contribution, which is $28 million paid each year by influenza product manufacturers that use GISRIS. 70% of the money is used to help countries to prepare for an influenza pandemic, while 30% is set aside for a response fund. And so far, more than $320 million have been collected through this partnership contribution. The second mechanism is the Standard Material Transfer Agreements 2. And these are agreements with entities that receive influenza viruses with human pandemic potential. And here recipients sign contracts to provide benefits, including medical countermeasures like vaccines, diagnostics, or therapeutics to WHO for distribution to countries in need in case of an influenza pandemic. And here so far, an estimated 700 million doses of influenza vaccine have been secured, along with 250,000 diagnostic kits, 25 million syringes, and many other benefits that I won't go into here. And finally, my last slide, I just wanted to briefly mention the process that is underway to negotiate a pandemic agreement. And that's the reason I couldn't be with you today, because that process is ongoing this week. So just a little bit of background, in 2021, in the midst of the COVID-19 pandemic, WHO member states decided to launch these negotiations at a special session of the World Health Assembly. The Intergovernmental Negotiating Body is currently in a resumed session of their 12th meeting, and they have a mandate to conclude negotiations by the World Health Assembly in May 2025, next year. They plan to meet at least twice more before than after this meeting. And why it's relevant to this presentation is because the current draft of the agreement that they're currently negotiating includes a pathogen access and benefit sharing system. and that could cover a broader range of human pathogens, including both their physical form and genetic sequences. The details are still under discussion, but I just wanted to mention that as something that is relevant to these discussions. So thank you very much for the opportunity to speak to you today. As I mentioned at the beginning, I've included my contact information on this slide. Please don't hesitate to reach out with any questions at this email address. And I just wanted to thank you again and turn back now to the moderator of the panel. Thanks very much.
Thank you very much for the presentation. And I think Dr. Hugen Dobler's presentation really highlighted public health sector perspectives on the Nagoya Protocol, providing updates also on the negotiations on the pandemic treaty. And he really showed the importance of ensuring that public health sector related needs are fully considered and integrated in the implementation of the Nagoya Protocol. So thank you very much. So quickly moving on to the animal health sector. Now it is my pleasure to invite Dr. Scarlett Sett, Project Manager of CSIRO, Australian Centre for Disease Preparedness, which is a WOAH reference laboratory in Australia, to talk about the Nagoya Protocol and its relevance to animal health sector. Dr. Sett, you have the floor and you have approximately 8 minutes, but given that we are a little bit pressed with time, we would appreciate if you could keep the presentation short. Thank you.
Thank you very much. I hope I'll make it very quick. Let me see, can you? Can you see my screen? Can you just give me a thumbs up?
Yes, we can see.
Yeah. Okay, perfect. So good morning, good afternoon, and good evening to all of you listening. Thank you for the invitation to this session. Yes, my name is Scarlett Sett, and I work for the Australian Centre for Disease Preparedness. And I will be talking to you about standing on the edge and why, as reference lab, we might have to consider ABS obligations under various international legal frameworks. And I really put ABS/Nagoya Protocol on purpose like that, because a country can still be non-party to the Nagoya, but have ABS obligations that have to be respected if those genetic materials are being used. So I will start by telling you a little bit about who we are and what do we do. So CSIRO is Australia's national science agency, and its main goal is to find solutions to today's greatest challenges through innovative science and technology. So the Australian Centre for Disease Preparedness, or ACDP, sits under the bigger umbrella of CSIRO and is a vital part of Australia's biosecurity infrastructure. So ACDP helps protect Australia's multi-billion-dollar livestock and agriculture industries, and also the general public, from emerging infectious disease threats. So as the only high-containment animal health laboratory in the Asia-Pacific region, this expertise is also used to assist neighboring countries in the region in their efforts to control and eradicate infectious animal diseases, and thus contributing to regional food security and biosecurity. So this support not only reduces the disease risks to the countries themselves, but it also assists the preparedness of Australian biosecurity through better threat assessment and preparedness. So this work enhances the region's capacity for disease diagnosis and emergency outbreak response, all within a framework of Australian standards and biosafety and biosecurity. So we work together closely with veterinary and human health agencies globally. As we know, about 70% of emerging infectious diseases in people originate in animals. So I will not go through each category individually, but you can have an overview of the different bodies that we support. So our main regional programs focus predominantly on high-impact diseases such as foot and mouth disease, swine fever, rabies, and highly pathogenic avian influenza. So not shown in the slides are the national network of veterinary laboratories that have been developed to ensure that states' veterinary labs are prepared to contribute to outbreak testing of key terrestrial and aquatic diseases, and of course, regional networks of specific interest targets. So ACDP is a WOAH designated reference laboratory for several high-impact diseases of terrestrial and aquatic animals. So experts in reference labs work as part of an international network of people to create a solid knowledge base, a pool of resources and information about high-impact animal diseases that can then be easily accessed and shared. We also provide training opportunities for the networks, and these labs are focused on high-impact diseases which are those capable of having severe effects on production, trade, environment, and in some cases, also the health of people. And I'll go back now to why we think these international frameworks are relevant to the activities that are carried out in reference laboratories. So first of all, there is a general assumption that the work carried out by reference labs would not fall within the scope of the Nagoya Protocol for two possible reasons. So the first one, and I'm glad that the previous presentations have touched on this article. I'm not going to go into detail, but I'll just mention it. The first one is that activities by reference lab might fall under Article 8B of the Nagoya Protocol, which states that there should be special considerations in regard to present or imminent emergencies that threaten or damage human, animal, or planet health. So that could be one of the assumptions that why reference labs so far have thought that they have been excluded from having any obligations with the Nagoya Protocol. The second one is that services provided by a reference lab might not exactly fit under the definition of utilization under both the CBD and the Nagoya Protocol. So let us look at the definitions. So I'm not going to go into both because I think for pathogens, we would definitely fall within the scope of the definition of what genetic resources are, unless, of course, they are exempt by national regulation. However, utilization is defined as to conduct research and or development on the genetic and or biochemical composition of genetic resources. So diagnostic services that reference labs provide are in general not really interested in understanding or developing knowledge on the genetic resources themselves, but rather identifying what they are doing in an outbreak scenario. Of course, they do involve genetic or biochemical analysis or testing for the identification, but not for the purpose of research and development. However, the tricky thing becomes when that material that was transferred to a reference lab were to be used for research activities other than just identification, like characterization or understanding of what the pathogen and its derivatives, then these activities might fall within the scope of the Nagoya Protocol and might require or trigger an ABS process with the providing country. And this is something that we currently at ACDP are exploring if we would be interested in using those resources for other purposes than just diagnostic testing. What would that require? How can we create some collaboration with the providing countries? Another issue that might arise is when national reference labs in the country where the outbreak is suspected are shipping samples to the reference labs abroad for identification. However, these national reference labs in the providing countries are not always necessarily linked or have a relationship with their competent national authorities regarding ABS, and these activities are therefore not being reported back to the correct authority. So there's a lot of sharing of pathogens on the WOAH reference lab that has not been reported back to the CNAs or the national focal points of ABS. So what are the challenges, but also opportunities for WOAH reference labs and member countries regarding compliance with these international frameworks, and in specific for ABS compliance? And I will start with the challenges because I like to finish with a positive note. So the biggest one, in my opinion, is that ABS is complex and goes beyond the CBD and the Nagoya Protocol. So there are also other frameworks that have ABS systems in place that might be relevant. And keep in mind, again, that you do not have to be party to the Nagoya Protocol in order to have established ABS law. So that's why I'm always a little bit careful just to say about Nagoya Protocol obligations, because you could have obligations under another framework. Especially in the space of animal health, you might actually fall in the scope of other international frameworks, like the plant treaty or the new pandemic treaty that is being discussed at the moment. So looking exclusively at the Nagoya Protocol might be a little bit short-sighted. So while the Nagoya Protocol is an international agreement, implementation at a national level is key for its success. And naturally, this will lead to challenges because there will be discrepancies in interpretation of ABS and how measures are implemented, and you have to navigate this on a case-by-case basis. I'm not going to go through the definitions, but these are some of the issues that we've had. Some people consider access not the same as collection, or they just regulate certain material, or there are some exemptions if it's taxonomic research. And then I took this screenshot from the ABS clearinghouse website, right? So the other challenge is that countries can decide if and how they regulate access and the conditions to their use. That means that you see that all of the ones in green are a party to the Nagoya Protocol. And then you have, for example, the ones that are in gray. So Australia is not party to the Nagoya Protocol, but that doesn't mean that we can just go and take material from whichever country we want and not respect their ABS regulations. So another point that I included here as a challenge is that although we know the system is not perfect, it is an established legal framework that took years in the making. And if we do not comply with our obligations, there will be consequences. Among them, some of the countries have already put researchers in jail for being non-compliant, and some of the non-regulatory consequences are loss of reputation and trust with providing countries. And here I just show a couple of snapshots of publications in Science since 2019 about what measures countries have already taken when users cannot prove the legality of access to the resources. And I would like to begin, this is my last slides, I know that we're close, but I would like to begin with a reminder. So let us not forget these frameworks exist because there were needs identified that needed to be addressed at an international level. And although it might seem difficult and challenging to deal with these issues, they're here to protect both the user and providers of genetic resources. So I see a lot of opportunities to continue the advancement of science and strengthen collaboration efforts, and at the same time, increase benefit sharing from those activities. So most of the work that is done in the research community in the form of project collaborations, capacity building, knowledge transfer, that's considered non-monetary benefit sharing, although there are big monetary components to finance those activities. And these activities are often overlooked or ignored, but they are there with large contributions. So as reference labs, and I'm just talking again just from ACDP, we have the international program that provides training and opportunities to develop better diagnostics in all these countries in the Southeast Asia. And this is actually not covered on the WOAH activity. This is additional to the WOAH reference lab activities. So my last point is actually just to encourage, because we will have here from policy and also practitioners, but just to encourage the collaboration and engagement of practitioners with the relevant national policymakers to develop cohesive and practical solutions for other countries. So this is crucial. Policymakers need to be informed by their in-country scientists on how data and samples are used in the real world and try to inform the decision-making process before legislation is imposed and do not match actually the practical realities. So if you're here from your government, reach out to your national researcher and ask them for advice. And oftentimes both groups are talking about the same thing and wanting to go in the same direction, but just using different words. So you just have to talk to each other and communicate and start that dialogue and see how you can develop cohesive solutions. And I will stop with that.
Thank you very much, Dr. Seth, for highlighting animal health sector perspectives on the Nagoya Protocol. And I think you made important points about some of the definitions and the scope of the Nagoya Protocol and related challenges, and the fact that ABS is a very complex matter and goes beyond the CBA and Nagoya Protocol, and issues around the interpretation of ABS and implementation of measures are very much left at the national level. But I think it was very nice to hear about opportunities for future actions that you have highlighted. So thank you very much for your insight. And now it is my pleasure to invite our last speaker for this session, Dr. Madhu S. Dhingra, Senior Animal Health Officer of the FAO, to share perspectives on the Nagoya Protocol and its relevance to animals. Dr. Dhingra, you have the floor, and we would appreciate if you could keep the presentation short.
Thank you. Thank you very much. Can you see my slides? Are they in full screen?
Yes, we can.
Okay, great. Thank you. So it's been very interesting, and a lot of speakers have already covered a lot of ground. So I just want to bring this back to why the Nagoya Protocol is important for the food and agriculture sector. So within FAO Strategic Framework 2022-31, which seeks to have efficient, inclusive, and resilient agri-food systems for better production, better nutrition, better life, and better environment. So here, within our One Health Priority Program, which is really One Health in agriculture, you can see these key areas of work that we have. So it relates to biosecurity for pest and disease and invasive alien species prevention, early warning, disaster risk reduction, managing national and global health risks, and the last one is safeguarding biodiversity and ecosystem health. And as you can see, these primary SDG targets, one of the SDG targets is SDG 15, which again relates to safeguarding biodiversity, natural resources, and promoting conservation. So our One Health work spans animal, plant, forest health, aquaculture health, land health, water health, and soil health, and all of those safeguarding the health of those agri-food systems and the ecosystems around it. And the work that we do on Nagoya is a very important part of this. Okay. So a lot of people have already mentioned this. The scope of Nagoya, the benefits arising from the utilization, but also the traditional knowledge associated with it. And as has been highlighted, Article 8 is an exception. And within and special considerations can be applied within those Article 8 considerations. So one of the things that I want to draw your attention to is really regarding the where this exception can be applied in 8B, which is due to present or imminent emergencies that can threaten or damage human, animal, or plant health. And parties may take into the consideration the need for expeditious access to genetic resources. But of course, as mentioned by the previous speaker, all this has to be done within the existing national regulation. And then I want to highlight also Article 8C, which considers the importance of genetic resources for food and agriculture and their special role for food security. And I'll touch a little bit upon this in my next few slides. Now, what are the potential ramifications of the Nagoya Protocol for animal genetic resources? So one of the ramifications is that it might lead to legal disputes in terms of tracing the origin. And, those are linked to a lot of provenance-related issues where animals the origin needs to be traced for benefits. Then the protocol compliance complicates international breeding programs, or it may obstruct or delay research for genetic improvement or genetic conservation as well. And of course, this leads to cost increase for breeding companies and research institutions. Again, private sector investment might decrease due to all these complications, and that impacts innovation in the field. The need to protect knowledge may increase the role of livestock keeping communities in decision-making on utilization of genetic resources. So those livestock keepers need to be brought in, and often this is not really considered when thinking about, developing breeding programs or conservation programs. Then I'd like to touch upon, that a lot of the traditionally or historically, a lot of the gene flow for genetic resources has been north to north or north to the south. So high-income countries obviously do not wish to impede this movement. And these kind of sales of genetic materials are generally exempted from the protocol, generally exempted. And again, this relates to the legislations. Again, research and international cooperation on animal genetic resource has been impacted. Because sometimes what happens is obtaining the necessary agreements to conduct the research takes very long. And often the project that is funding the research might even end by then. Then again, benefit sharing needs to be accounted for in those project budgets. And sometimes these budgets, nobody has thought about this and that money is just not there. And then, of course, it leads to a lot of documentation and general bureaucracy, which people just give up after a certain point. Then what happens when there are these delays in restricting materials, access to genetic materials. So obviously, donor countries don't benefit from improved tools. And those improved tools could be tools for disease control, new or updated vaccines, diagnostic tools, or any kind of economic benefit. This has been mentioned before. Animal disease control authorities are unable to track the spread of pathogens or identify and manage risks arising from the spread or emergence of novel agents or strains because they don't have access, they don't have these improved tools. Public health authorities can't access animal pathogens which have zoonotic or pandemic potential. This has been mentioned before, and we are really looking forward to see what comes out of the pandemic agreement. And of course, manufacturers cannot access newly emerged strains or develop new vaccines or update existing ones. Now, in FAO, there was a need to sort of conduct a problem statement or evaluate the problem statement of why Nagoya is hindering all these aspects of exchange of genetic material for animal health. So the European Commission for Foot and Mouth Disease in 2020 established a multi-stakeholder platform on vaccine security. And there was a meeting that was convened to bring together all the experts which are involved in the manufacture of animal vaccines, particularly transboundary animal disease vaccines, and FAO, WOAH, NGOs, legal experts. They were all brought together, and they sort of looked at what the problem is with Nagoya and the use of genetic material. So in principle, they found that, you know, the exchange of genetic material for diagnosis and surveillance is not strictly considered utilization within the context of the protocol. And if you look at this figure, so, you know, if a farmer has, you know, an outbreak of a disease, he or she can submit the sample to the veterinarian. It can be shipped to the reference laboratory. It can be diagnosed, and all that can be exempt from within the context of the protocol. But when it gets into the aspect of utilizing it for either developing a vaccine or product, that's when ABS legislation comes into play. So national ABS legislation may extend the scope of the protocol to cover other activities and materials, including digital sequence information. But often it is the complexity and the lack of understanding and multiplicity of the responsible authorities that leads to delay or refusal to exchange the genetic material. And then that's where I think the One Health aspect comes in. It's not just about, because multiple authorities need to work together to solve these solutions. And these are some examples where you know, this exemption can apply. So first, one example is a new serotype of foot and mouth disease might emerge, which recently has happened in North Africa. So the sample would be sent to the World Reference Laboratory. It is compared with the existing vaccine strains, which are available in the world. And that allows the reference laboratory to say, you know, this vaccine or that vaccine containing X, Y, and Z serotype is the best match for effectiveness of use against this strain. In Asia Pacific, recently, there was a recombinant strain of lumpy skin disease suspected, and that isolate would be sent to a reference lab and compared with known lumpy skin disease strains. We heard about the PIP framework, but it is equally important in global influenza surveillance, where FAO and WOAH reference laboratories work together to monitor the circulating influenza strains and then provide advice on avian influenza vaccine matching to ensure that local strains, countries that want to use vaccines can keep up with the changing local strains and use appropriate vaccines. So these examples are not really money-making examples, but these are examples of this component, you know, where it can be used, and it's really the purpose of saving the losses that can occur when these kind of situations arise. So with this meeting that was held, there were some actions to resolve the issues identified, and some subsequent work has also been taken place. So one of the key things is to raise the awareness and the understanding of the protocol, because often, you know, countries don't understand it and they just block the process. The second is to develop standardized agreements with recognized networks of reference laboratories that are compliant with the protocol and, of course, the national ABS legislation. And then there's considering the possibility of developing specialized multilateral ABS instrument, which is aligned with the requirements of the protocol and that has animal pathogens within it. Within its scope. It's similar to the International Treaty on Plant Genetic Resources for Food and Agriculture. And then explore the role of virus archives or biohubs in allowing rapid access to genetic material of animal pathogens for different purposes, including commercial exploitation. Now, shorter procedures do exist, such as the one that CITES made during COVID, and learning from these lessons and solutions are really important, and fast sample shipments can happen, but again, it needs in-country collaboration between multiple ministries to prevent these disasters, which can lead to huge food security losses or health emergencies. So we look forward to seeing the discussions of the pandemic agreement to see to which extent animal pathogens will be covered within that as well. And with that, I stop my presentation. Thank you.
Thank you very much, Dr. Dhingra, for your very comprehensive presentation and really highlighting the relevance of Nagoya Protocol, as well as One Health for food and agricultural sectors, animal genetic resources, and also really highlighting relevant requirements on the Article 8 on special considerations, their implications on animal genetic resources and challenges faced, and also highlighting the suggested actions, which are very useful insights for all of us going forward. So thank you very much for your contribution. So this brings us to the end of the second part of the webinar, and we have heard a wide range of sectoral perspectives in terms of the relevance of the Nagoya Protocol, needs and priorities, as well as challenges. And I think we can all agree that ABS is a very complex matter. And for the successful implementation of the Nagoya Protocol, all the different perspectives, needs and priorities and challenges faced by different sectors that we heard today is addressed in a balanced manner. And I think that's where the One Health approach and collaboration platform could really play a key role by strengthening collective efforts by multiple sectors to achieve the common goals. So I'd like to thank all the speakers for sharing their valuable insights. And with this, now I'd like to hand it over the moderation role to my colleague, Dr. Lisa Thompson, Deputy Regional Representative of the World Organization for Animal Health, Regional Representation for Asia and the Pacific, to moderate the next part of the webinar. Lisa, over to you.
Thank you very much, Makiko. Thanks everyone for joining us today, and for those of you watching the recording afterwards, I hope you find it interesting. So now that you've had a really good overview of the Nagoya Protocol on access and benefit sharing, you've had some sectoral perspectives and experiences. Now we thought it would be really useful to share some good practices from member states. So we will highlight ongoing efforts for those that are implementing the Nagoya Protocol, hopefully have some current information on what's actually happening on the ground level, and also try to highlight what is being done for accommodating One Health and options for legislators at the national level that are trying to support implementation of the protocol. So first I'll introduce the speakers that we have. So if I could have the next slide. So very pleased to have Dr. Varsha Potdar with us today. She will be speaking to us live. She's head of the National Influenza Center, the National Institute of Virology in Pune, India. She has made significant contributions to virology, particularly in the areas of influenza outbreak investigations, epidemiological and virological surveillance, and molecular characterization of respiratory viruses. So we look forward to her telling us some success stories in India. And next up, next slide, we have Dr. Jeffrey Cruz, who has prepared a short recording for us. He is a government veterinarian specializing in animal disease diagnosis, focusing on viral infectious diseases. He has a strong commitment to One Health principles and brings valuable insights into applying the Nagoya Protocol in the context of animal health. And his experience is in collaborating with experts from the World Organization for Animal Health Reference Laboratory. I believe we need to, I think this panelist has not joined us, so we'll skip to the next slide. Next slide, please. Just to introduce Mr. Rahul Chand, who has also shared a presentation with us. He is coordinator of Protected and Conserved Areas Programme, working at the IUCN Oceania Regional Office in Fiji. And his experience is in biodiversity conservation planning and policy implementation. And he has contributed to national and regional biodiversity strategies. He has expertise in capacity building in ABS mechanisms under the Nagoya Protocol. So we will start with one of our pre-recorded presentations. We'll hear from Dr. Cruz, who will give us an example of a country sharing experiences with challenges and recommendations for using the Nagoya Protocol. I would like to ask our IT to play. Thank you very much. We don't have audio. Can we just check the video audio, please? We'll just get the video queued up again.
Thanks for your patience. Hold on a second.
No worries, Jim. Thanks very much. You've been very busy getting all the presentations on the screen, as well as managing all the systems going to YouTube. We still don't have audio, Jim. It was working fine when we tested.
Apologies for that.
Thanks everyone for bearing with us. Hopefully we'll have video ready with you soon. We're still not hearing the audio, Jim.
Sorry, Lisa. I think we might have to improvise at the moment. Looks like our presentation is not working.
Jim, can I upload from my end?
Yes,
I
please.
have
Thank
it
you.
ready to go as well if
Oh,
you need
yes,
someone to
yes.
share.
Lisa, that would be good.
Thank you.
Let me
Thank you.
just try. There's an issue for me to share sound, sorry. When I tried to share, it is not giving me the option to share sound. So maybe could you try Sitara?
Can you see my screen?
We can see your screen. We
Yes.
see the
Okay.
full screen, yes.
Yeah, then maybe I'll start playing.
Yeah. Just put it on full.
First, I would like to apologize for not being able to join you live for this webinar. And also, I would like to express my gratitude to the World Organization for Animal Health for giving me this opportunity to share my experiences on good practices in access and benefit sharing. So as you can see, the Philippines has a relatively long history of regulating biodiversity activities. So as early as 1992, the Philippines was one of the earliest signatories of the Convention on Biological Diversity. And it is the 31st state to ratify the Convention on Biological Diversity. So the Philippines started regulating its bioprospecting activities through the Executive Order 247. This establishes a framework for access to genetic resources, and it is considered to be the first access benefit sharing law globally. So the Philippines acceded the Nagoya Protocol and entered into the force before the end of 2015. These are some clauses from the executive order regarding the minimum terms and conditions for research activities. So this is for bioprospecting and benefit sharing. First is the equitable sharing between the government and the researchers. So all benefits from bioprospecting activities, whether direct or indirect, should be shared fairly with the funding government, the affected communities, and the researchers. Second is the equity for technology, product development. So if the resources from the Philippines are used to develop the technology. Next is for royalties. So the royalties, benefits, and any resulting technology will be transferred to the Philippine government and the affected communities through a separate agreement. And lastly, the donated research and equipment. So any equipment used in the research will be donated to the relevant Philippine government agencies or institutions. to share one of our success stories of access benefit sharing is our collaboration with Changchun Veterinary Research Institute in China. So the project study focuses on the evolutionary dynamics and phylogenetic analysis of rabies virus from the Philippines. So the study aims to understand the epidemiological situation of rabies virus and obtain a full genomic sequence of rabies virus field isolates from the Philippines. So these are the accomplishments of the project. So the study successfully sequenced 353 whole genomes of rabies. These samples were collected between 2018 to 2022. So the study also successfully optimized the use of a FTA card from sample transport to nucleic acid extraction, and the study also establishes the phylogenetic analysis, and lastly illustrated the intra and intertransmission patterns of rabies virus in the country. So the study illustrated the genotype of rabies virus recurring in the Philippines is the C4 subclade only, and genotypes from other countries have not been identified. And rabies virus within the C4 subclade are further classified into 6 lineages: the C4L, M, GRSL, GRMD, and the MC, with the former 3 as a predominant strain circulating in the country. And the lineage C4MC is a newly discovered lineage from the region 9 in the Mindanao Island, which is first identified in this study. It was observed in the study that major transmission way is through the intra-island transmission, and that the inter-island transmissions are limited because of the natural barrier like the ocean. But as you can observe, there are some transmission of lineages from the island of Luzon and Mindanao that is transmitted into the island of Visayas. One of the major challenges that we experienced during the conduct of our research is the delays in bureaucratic approvals. We experienced delays in obtaining the necessary permits for us to export the rabies samples. So this approval process was time-consuming, which heavily affected our project timeline. So next challenge is the lack of awareness on Biological Diversity Act. While there is a law in the Philippines regarding access and benefit sharing, many researchers are unaware of its requirements and how to navigate the process. So this lack of knowledge led to the misunderstanding and delays in the project deliverables. In my opinion, these are some key strategies in order to improve access benefit sharing implementation, not only in the Philippines but also in other countries. So number 1 is to simplify and streamline EPS regulation. We can create a single window application system for securing an EPS permit. So this will reduce bureaucratic red tape and the processing times. Second is to enhance awareness and capacity building. We can conduct comprehensive awareness campaigns about EPS provisions, and we can provide targeted training programs about various stakeholders, including researchers and local communities. And third is to strengthen the institutional capacity. So improving the ability of the government agency to manage EPS system is also one good strategy, especially here in the Philippines. So this can also enhance the multi-sectoral and interagency collaboration. We can do this by developing supporting information systems like research database for genetic resources. And lastly, revise or revisit the existing regulations. We can incorporate new policies that are sustainable, respectful of community rights, and environmental friendly. Thank you very much for listening. So this is my last slide. If you happen to have any question or clarification, just feel free to email me. So I will put my contact details in this slide. Thank you very much.
Thanks very much. I do apologise. We had a bit of issue with the IT logistics there and also with the sound, but perhaps we can improve that for the recording that will go onto YouTube afterwards. I think I just double check. We do have another video. I don't know, is anyone able to share that now, or shall we go to Dr. Potdar first. Sitar, do you have the other video? Okay, let's hear from Fiji then. Sorry, we don't have audio again.
Okay, sweetheart, if you can, please, thank you.
Let me
So-
try from my end, Lisa.
Thank you.
It's Rahul's, right?
Yes, please.
Regional Office for Oceania, which serves 14 Pacific Island countries and then Australia and New Zealand. In my previous role, I was working for Secretariat of the Pacific Regional Environment Program, SPEP, which is based in Apia, Samoa, and we were executing a regional project that was implemented by UN Environment or UNEP. This project was for 3 years, and we were working in all 14 Pacific Island countries. So I thank Makiko for having invited me today to speak at this very interesting webinar, and I hope that I will do justice to the request that you have made, Makiko, to highlight some key challenges, key issues, success stories, and link the work that we have done on access and benefit sharing, the concept of One Health. So I have included a couple of paragraphs about how we can work on access and benefit sharing. Learn from what you've done in the past, what you're currently doing, or what UN Environment, FAO, and other UN agencies are working on. So, in terms of what I can present today, is sort of seeing that could perhaps happen in terms of access and benefit sharing in the Pacific Island countries. I would also like to highlight some of the major challenges that we see in these countries whilst communities, government officials, non-governmental partners and organizations are implementing the Nagoya Protocol, which deals with access and benefit sharing. One of the cornerstones of the successful implementation of the Nagoya Protocol is the compliance measures or the compliance regime. So I will also share some information on the nature and extent of compliance measures in the Pacific, and also share some success stories, because without success stories, all other stories become very boring, and I don't want to be that discussion. So I will share you some of the success that we encountered as so in terms of past experiences from the community's point of view, from the government officials, from many partners, competing agencies that are working in the Pacific, and I'm talking about generally all the 14 island countries. One of the things that is very common that we all heard was about the misappropriation of traditional knowledge associated with the use of genetic resources. So once you visit with them, they will share stories about one particular flora that they know, that they have used, that they believe is their traditional sort of a plant, and they know how to use it, prepare it, the formula or the recipe of how they've been preparing this particular product have been stolen from them. They give you accounts of how this information has now appeared in some other parts of the world and someone else claims ownership under its name to a process of patenting, the process of registration or whatever it could be. And they're totally surprised and shocked about this. Or there could be other similar issues of biopiracy. Biopiracy in terms of particular flora or fauna that has been moved out of the region without they may have encountered tourists, they may have encountered people who come under the guise or disguise of researchers, and they're very friendly and they move around freely in the community, in the villages, around the coastal stretches, and people provide samples.
Sorry, we've lost sound again. I think those watching on YouTube have the subtitles. Okay, so I think we have some technical difficulties with playing the videos. We also had a little bit longer video from Rahul, which we're very grateful for, but we are running out of time. We've already gone a little bit over. So what I'd suggest we do is we will share the full video, the full 22 minutes after the event. But for now, I think we should get back to our guests who are actually with us today. So apologies that we have to cut in partway through the video. But now I'd be very pleased if we can speak to our panelists who are with us just now. So I think I would like to ask Dr. Poddar. I will just share, and we had a few questions for you. Let me just share the questions. If I can find questions. Perfect. Thank you so much, Jim. So if we could ask you first, Dr. Poddar, to briefly outline your sector's approach to ABS, and whether there are any local priorities and policies that influence the implementation. Then secondly, if you have a success story or case study from your own experience that you could share from India, maybe if you had some challenges or key lessons learned, I think those would be really interesting to share with our audience today. And finally, if you have some key recommendations for improving implementation of the mechanisms to maximize their impact, leveraging the One Health approach. So I will pass over to Dr. Poddar, please. Thank you. I think you have a few slides for us.
Thank you, Lisa. May I have my slides, please? I can share from my side.
Sorry, Dr. Varsha. Yes, please. Can you please share from your end?
Can you see my slides?
That's perfect. Go ahead, Dr. Poddar.
Yeah. So good morning, good afternoon, good evening to all. I'm representing ICMR National Institute of Virology, which is located in Maharashtra state of India. And I'm heading the National Influenza Center, which is established in 1980. We are also a reference laboratory for H5N1, and we are now recognized as a WHOCC for emerging and re-emerging pathogens. So today, to answer your questions, I will more focus on influenza. That is my area basically. So we are conducting year-round now the integrated surveillance for influenza and SARS-CoV-2 after the COVID pandemic basically, and we have a nationwide basically a network of viral diagnostic research and diagnostic laboratories, which are a medical college based laboratories. And continuously the data has been like year round, we are following the same SOP, sample strategy, testing protocols and reporting protocols. So this is our data generation basically for the seasonal influenza. We also, during the COVID, we have established the nationwide INSACOG network, which is mainly for the SARS-CoV genome sequencing, and we have reported this data to GSAID for further global action and for Indian scenario also to take a policy decision. So what access and benefit we have achieved in this through NIC basically. So I will say that NIC efforts are well aligned with the WHO pandemic preparedness, influenza preparedness PIP framework. And through GISRACE, which is a key component of PIP, we are sharing as a NIC, we are sharing epidemiological and laboratory data every weekly to the GISRACE platform. We are also sharing our sequencing data, influenza, seasonal influenza, and zoonotic influenza. If we have any detected in human population, we are sharing that data with the GISRACE. And this is in line with NIC accepted TOR, and obviously the government is in acceptance with government. We also have a scientific and technical support to regional CRO member states. We conduct a lot of trainings, capacity building for diagnostic, virus culture, genomic sequencing, and also support for the reagent supply. What benefits against all these things we are receiving from WHO? Access to epidemiological and laboratory data from the world. We can see at a glance. Anytime we can download, we can check at what is happening in other parts of the world. Then we also get the technical and scientific support from WHO CCs. Reagent supply for influenza diagnostic and other respiratory diagnostic from influenza international reagent resource. Then global influenza, we also get like participation in EQUAS program, global EQUAS program, which are conducted for influenza, SARS-CoV and RSV. WHO supports for capacity building through teaching, training, knowledge sharing through meetings and workshops. And during pandemic, we also received diagnostic kits, positive controls, and vaccine and antivirals. So basically, we face, as such, we don't face any challenges during our routine activity as a NIC function. Now I will move to the second question. What is the specific success story? In this, I would like to elaborate more on the COVID pandemic, though the GISRACE was not fully kind of prepared for non-influenza kind of pandemic scenario, but still we could accept that challenge, like we could through with this pandemic. And how was our approach? So preparedness is a key basically, and that NIC is very well tune for the preparedness for influenza or any novel virus pandemic. So priority was given to the strengthened molecular testing at WHO recognized National Influenza Center, which is our laboratory. We are also recognized at the beginning of the pandemic that COVID reference laboratory for country and CRO region. So our journey started from January 10, and we have started with our pan-corona related primer probes, and up to 30th January, we have detected our country's first case of COVID positive. And between that time, we have already standardized our real-time PCR for SARS-CoV detection. And this was fully successful because of we got the genome information timely from the WHO, and also the positive control from Charité Germany lab through WHO efforts. So this was basically because of this we could actually validate our in-house test protocol, and we can run the we can diagnose our first case of COVID-19. In response to COVID-19, we have then, as the pandemic progressed, there was a need of testing. So our single gene tube assay, then we have converted into 2 tube assay. One was screening assay, the second was confirmatory assay, and then finally we come up with the single tube multiplex assay with all 4 gene together. But this all development we could validate because of we got a timely help from WHO laboratory centers as well as from the laboratories. They provided us the positive control, and that's how we can come up with our own testing diagnostic kit. During COVID, every country has faced this shortage of reagents, diagnostic kits, RNA extraction kits, and that's how in India we have basically promoted Make in India approach, and many stakeholders from the private sectors come forward, and we handholded them for establishing the diagnostic reagents within the country. We have also, as I mentioned, we have established the INSAFOG network for building a database for Indian SARS genome surveillance, and this was hub and spoke model. Through that, we could detect all the variants in the country, and timely the strategy as well as the policy decisions has been taken care with this information basically. We have also supported CR countries for testing, as well as we have supported by providing them the reagents and diagnostic activity. So we had a calibrated expansion of our testing laboratory. You can see these different sectors we have included as and when there was a need for expansion of the testing strategy. So in all in the country, within the short period of like March 2022, we have established more than 100 laboratories, government laboratories for the diagnostic, and up to June we have also included private sector laboratories which are enable accredited. So there was a systematic efforts we have taken to expand the testing capacity of the country, and by end of June we had more than 3,000 laboratories functional in the country. So data generation and data flow was actually monitored through ICMR, which is our parent institute, which is the Indian Council of Medical Research. And this data was then shared with all the stakeholders, including PMO office, Prime Minister office, cabinet secretaries, and other stakeholders for timely taking the control measures. So what lesson we learned from the COVID pandemic? Basically, unlike influenza, other respiratory viruses may have pandemic potential, and there is a need to be vigilant, or there need to be a preparedness for handling such situations. And that's how the year-round respiratory surveillance is basically a key for getting prepared ourselves, identify diagnosis early events basically, and that's how we will be prepared for any emerging situation. So third question was, what are our key recommendations? First of all, it's basically the previous speakers have already mentioned the One Health approach, which is required, holistic and integrated approach based on like all sector, considering all sectors. So in India, we have established this National Joint Outbreak Investigation Team. These are the collaborative governance mechanism in the National One Health Mission. So you can see multiple agencies are part of this network. We have also identified the national network of BSL-3 laboratories, and we have made sure that their laboratories are functional, they are well trained, the SOPs are with them, and the reagents supply is also timely available for this laboratory. So for to deal with any emerging situation, what was the outcome of the training of this BSL-3 laboratories? Basically, we could map infrastructure, we could identify the training needs. We have also had a pool of trained technical staff. Then we have prepared the master standard SOPs, comprehensive list of equipment we made, and then training on biosafety and biosecurity for handling high-risk pathogens in BSL-3 laboratories. And this is with all the three sectors, like human, animal, and environmental, considering all these three sectors. And also we have identified the priority pathogens which need to be, which these BSL-3 laboratories will be concentrating on. So our key recommendations are to undertake and establish integrated and holistic R&D across human health, animal health, and plant and environment for early detection of epidemics, pandemics, following One Health approach, and this can be adopted by our member states. Foster and adopt multi-sectoral data sharing, which is not only for seasonal but for zoonotic pandemic potential viruses circulation in and around our neighboring countries. The second is foster linkages. Our previous speaker have already highlighted this with global efforts for pandemic preparedness, such as Quadripartite. So we should be at par with the global efforts. Our efforts should match with the global efforts. And the strengthen in country and regional collaboration for pandemic preparedness by sharing key information of emerging and re-emerging viruses of pandemic potential. Thank you, Lisa. I will stop over here. Over to you.
Thank you very much indeed, Dr. Potter. I think it's been really enriching to hear the specific examples from different sectors as we're trying to navigate dealing with different diseases and the relevance of thinking about sharing of information and sharing of samples appropriately and according to the Nagoya Protocol. Thank you so much, Dr. Poddar. I'm now going to close the panel session and I will pass over to our next final speaker, who is Dr. Scott Newman. He is going to do our wrap up for the webinar. He's the Senior Animal Health and Production Officer at the Regional Office for Asia and the Pacific for FAO, and his technical work includes One Health and many other topics. I will hand over to you now, Scott. Thank you.
Great, thank you very much, Lisa, and good afternoon, colleagues. Hopefully you can hear me well. First of all, I would like to say thank you on behalf of the Regional Quadripartite for all of the speakers, moderators, and panelists for their contributions to this important Regional Quadripartite webinar on the Nagoya Protocol from a One Health perspective. And today we had the opportunity to learn a lot about the Nagoya Protocol and access to benefit sharing. Certainly we now recognize and understand better that this is an international agreement that aims to share the benefits arising from utilization of genetic resources fairly and equitably, including by appropriate access to resources
and by appropriate transfer of relevant technologies. We also heard about how the protocol reaffirms the sovereign right of states over their natural resources and consequently the right to regulate and make access to genetic resources subject to specific conditions such as fair and equitable sharing of benefits. While we know that the protocol was adopted in October 2010 and entered into force in October 2014, there continue to be new elements to be taken on and taken into consideration, given the importance of this protocol on multiple One Health sectors, including the conservation and production of plants, wildlife, crops, fish, aquaculture, livestock, agriculture, and the health of people, animals, both domestic and wild, and the environment. In this webinar, we've provided an overview of the protocol and the status of its implementation globally and at the Asia-Pacific level. We've also shared important information and lessons learned on negotiating and implementing relevant instruments, including the International Treaty on Plant Genetic Resources for Food and Agriculture and the Pandemic Influenza Preparedness Framework. We've also learned about the importance of access and benefit sharing approaches needing to be collaborative in approach across multiple sectors, and for ABS approaches to keep in mind and consider benefits to the whole of society. It was highlighted that there are potential differences in interpretation of ABS, given that each country can interpret if and how they regulate access to their resources. It was reiterated multiple times during the webinar that access and benefit sharing is complex and goes well beyond CBD and Nagoya protocols. And it's noted that the pandemic influenza preparedness framework may affect animal pathogens of zoonotic potential as well. It's important to learn from the experience and success stories to date, and some of these were demonstrated by the country panelists from India, Philippines, Thailand, and Fiji, as well as International Treaty on Plant and Genetic Resources for Food and Agriculture. The examples provided are from different One Health sectors and provide evidence that regardless of which sector we may represent, there are some practical solutions available that have successfully navigated a way forward across sectors and among sectors. In closing, we hope you're better aware of the Nagoya Protocol and the importance of access and benefit sharing, particularly from the One Health perspective. Going forward, we hope that we can continue to better develop collaborative approaches that enable equitable benefit sharing across the levels of society, whereby our health and the health of our food is safeguarded, biodiversity is conserved, ecosystem services are protected, and collectively we support and contribute to a better, safer future for society. Thank you very much, and we hope you've enjoyed this webinar. Can I pass the floor back to the moderator, please?
Yes, thank you very much, Scott, for the closing remarks. And on behalf of the Asia Pacific Quadripartite Partnership partners, I'd like to thank all the speakers who have shared valuable insights and contribution to the discussions today. And thank you very much for all the participants who have really followed our webinar today. So as I said earlier, we will make the recording of this session available. And we are also planning to continue to organize the webinars in the future as Quadripartite, potentially focus on different aspects of the Nagoya Protocol, but also covering many other different technical issues. So we very much look forward to your continued participation in our future events. Thank you very much, and have a nice afternoon and